I'm JoEllen Tarallo, Executive Director of the Center for Health and Learning and the Director of the Vermont Suicide Prevention Center, a public-private partnership with the Vermont Agency of Human Services, Education, Mental Health and Healthcare organizations, other nonprofits, foundations, people with lived experience, and donors to support suicide prevention in Vermont. We ask stakeholders to speak to their greatest wish for suicide prevention for youth, families, and communities across the state. Here is what they said.
My name is Christy Hummel. I speak for NAMI Vermont's In Our Own Voice program. I'm a 2-time suicide survivor. My greatest wish for suicide prevention is to change the language around suicide. Mental illness is not something that you can see and easily diagnose like a broken arm. We are all unique. We are all human. Yes, we still need more awareness, less shame, and an open and familiar vocabulary to talk about it. I look forward to a day when it's not just a hot topic, but a topic that we are discussing and problem solving with more than just hotlines, with more education and healthcare reform to support all affected by this. Thank you.
My name is Joe Smith. I am a veteran of the United States Army and a suicide survivor. My dream is to live in a world where veterans from everywhere, from all branches of service and all walks of life, can overcome the stigmas that are trained into them as far as seeking help with their mental health issues. There is a lot of stigma there, and I think that is a roadblock, and I would like to see a day where we can overcome that.
Hi, my name is Dana Kaplan. I'm the Executive Director of Outright Vermont. I use he and him pronouns.
And this is my kid, Rye. She uses she and her pronouns.
And this is my kid, Rye, and she uses she and her pronouns. We are dedicated to seeing that all LGBTQ young people have access to hope, equity, and power. In that world, systems youth navigate are spacious and affirming enough to embrace the beautiful complexities of our intersecting identities. Trans, non-binary, and queer youth, may you always know deep belonging and be met with all of the heck yeahs you ever need. You make this world so much better off because of, not in spite of, being your fiercely vibrant selves, just as you are.
Hi, I'm Linda Heimerdinger, social worker at Brattleboro Union High School in Brattleboro, Vermont. My greatest wish for the students at BUHS is that every single one of them has a close, trusting, and positive connection with at least one adult in the school community. That every day, school provides time for our students to seek out and check in with a trusted adult. And in this space, our students feel safe and are encouraged to share the wild roller coaster of adolescent emotions, feelings, and experiences. Joy, anger, delight, frustration, loneliness, happiness, despair, stress, embarrassment, triumph. My hope is that each of them hears the same message, but most importantly, feels it. You are loved, you are important, you are valued, your opinions and beliefs matter. You are not alone, you are understood, you make our community a better place.
Hi, my name is Carter Falk. I'm from Brattleboro, Vermont, and in 8th grade, I lost a friend and a classmate to suicide. What I want for the youth in my community is them to be taught proper ways to prevent or to notice when someone is thinking about taking their life. If we can educate the community better, then hopefully we can prevent the devastating loss of lives each year.
Hello, I'm Debby Haskins. I'm a suicide prevention specialist for the Center for Health and Learning and a licensed alcohol and drug counselor. When I think of suicide, I think of the extreme pain and devastation it causes a family and a community. I'm concerned that 30 to 40% of our youth are under the influence of a substance when they attempt a suicide. Therefore, my wish for Vermont is that everyone has access to substance abuse services, mental health services, and that we see these as interchangeable, that everyone has what they need when they need it.
I am Charles Gurney, and I work in the State Unit on Aging. We know that older adults have a high rate of suicide, so we are working on this with our community partners. Older adults are living longer and deserve to live in dignity for their full life. Suicide prevention helps make this happen.
Kwekwe Nadoba. My name is Brenda Gagne. In my language, that means hello, friend. I am a citizen of the Abenaki Nation of Missisquoi, St. Francis Okokie Tribe of Vermont. The suicide rate for the Abenaki is high. Our wish is that someday that there will be knowledge out there so that all our people will get the help that's needed and that suicide rate will go down to nothing. That would be a wish for all of us. It doesn't matter what color of skin that we have. For suicide not to be part of the world today would be an amazing thought.
Hi, I'm Ann Donahue. I'm a suicide attempt survivor and a state legislator. My greatest wish is that we had more focus on peer support. There's a lot of talk about bringing clinicians instead of police in a crisis. But for many of my peers, the clinical world can feel just as much a tool of oppression. If you can't share your feelings without fearing being taken into involuntary custody, how's that a safe space? We need safe support so that scary feelings don't stay hidden until they reach a crisis.
I am Dr. Debra Lopez Gottesman, a lifelong psychiatrist and clinical faculty member at the UVM College of Medicine. My son Alan killed himself at the age of 25 while he was a patient in a top-ranked psychiatric hospital. At every level of care, the clinicians he turned to for help lacked up-to-date training in suicide care and omitted protocols to ensure patient safety. My two greatest wishes are, first, that every primary care and mental health clinician in our state receive quality training in the care of suicidal people, including protocols for evaluation, treatment, and referral. Suicidal people deserve to find competent help when they seek it. My second wish is that the Vermont Suicide Surveillance Work Group expand its vision to include data on encounters with the health system prior to suicide death. We need better documentation of health system encounters to drive system improvements.
My name is Curtis Reed Jr. I am the Executive Director of Vermont Partnership for Fairness and Diversity, and my greatest wish related to suicide prevention is a coin on which one side, Vermonters of color, reject the stigma associated with getting help for racial trauma and suicide ideation. And on the other side of the coin, the presence of accessible, culturally appropriate mental health services, including sufficient numbers of practitioners of color.
Hi, I'm Jasmine Saya, and I'm the 2020 Youth Ambassador for the YYA program. I've been working with YYA since January 2020, and I find it very important and very helpful to spread the information that we are learning. Mental health is not a very talked about subject within a lot of communities because it is such a hard subject to talk about. There are a lot of people that do struggle with mental illness and will think about taking their own life, and they don't know where to get help. I think it's very important that we continue to spread awareness and make sure to let people know that this is a very severe problem and help people spread awareness of where to go if they need help or where to go if a friend needs help.
Hi, my name is Adam Bunting, principal of CVU High School. The most important message I have around suicide prevention is for our young people. It's the idea that there are moments in every single human life when we hit our low points, when we feel alone, when we're struggling, and when we question whether we're going to make it through or not. The challenge when you're young is you just haven't made it through that spot yet to know that you will, to know that you can trust yourself, and to know that there are people around you who love you, who are going to support you no matter what. It takes time, and it takes our community working together.